The next drugs that we'll talk about come from the cocaine and amphetamine class. So I kind of lumped them together because a lot of these symptoms will be very similar. Cocaine and amphetamines, such as methamphetamine, will share a lot of the same characteristics. And what acute intoxication of these drugs will include tachycardia, hypertension, insomnia, decreased appetite. Kind of reminds you of the autonomic instability picture almost. But one of the key things that I want you to remember is cocaine and amphetamine use will lead to pupillary dilation. So you'll get these very enlarged pupils during acute intoxication. You can also see heart arrhythmias, chest pain, and perceptual disturbances. The list goes on and on. However, these are some of the major things that you need to be looking out for. So pupillary dilation. The pupils can give you clues to what drug they're using. Pupil dilation makes you think, is it a stimulant such as cocaine or an amphetamine? You also get this thing with cocaine use specifically. It's called formication. Formication is one of those words I want you to commit to memory, also known as cocaine bugs. It's the sensation of having these little bugs crawl underneath your skin. So that's why you see cocaine users maybe sometimes pick at themselves or have little scars or scabs. It's because they have been picking at themselves because of formication, these bug-like feeling underneath the skin, so they're trying to pick the bugs out. So that's just one thing I want you to commit to memory. You may see it as a buzzword on the exam, but most likely they'll be describing kind of like a paresthesia or like a altered sensation underneath the skin where they feel like bugs are underneath their skin. Formication. Alright, so you just overdosed on cocaine, you've been doing it for the last 10 years, but we admitted you to the hospital. At the hospital, we're not going to give you anything. You're going to enter withdrawal state. Kind of the easy way to remember the withdrawal state for cocaine and amphetamines is it's going to be the opposite of an intoxicated state. So during cocaine use, you're feeling really good, you've got good energy. For the withdrawal, you have a decreased mood. You kind of have a depressed state. So fatigue, decreased energy, decreased mood, you're irritable. You'll also see the opposite of the intoxicated state. So in the intoxicated state, you could go hours, days without food. However, when you're off of cocaine, your appetite dramatically increases and you have an increased appetite. And then also you have hypersomnia, so an increased need for sleep. Remember, for acute intoxication, you didn't need to sleep. You felt great. You had tons of energy. You didn't need to sleep for a couple days. However, with the withdrawal, now you'll have hypersomnia. So an easy way to remember the withdrawal symptoms is pretty much the opposite of intoxication. Also, it's known as the withdrawal crash. So, how do we diagnose an amphetamine or a cocaine intoxication? The urine drug screen. That's going to be the simple way to detect it. It's detected in the urine, typically lasts for a couple days. Doesn't last months, but it does last a couple days, so you'll be able to pick it up in the urine. And then lastly, we move on to treatment. The mainstay for treatment of amphetamine intoxication or cocaine intoxication is going to be supportive. We're going to monitor their autonomic system. So we're going to be checking vitals every so often. We'll be making sure they don't develop any life-threatening instability. However, remember I said that amphetamine or cocaine withdrawal can lead to a decreased mood or kind of a depression state. For the most part, we're not too worried. However, if that depression or the decreased mood persists, you can consider giving an antidepressant. Not the most common, you won't see it all the time. However, just realize that that is an option out there. And then lastly, for the psychosis or agitation caused by an acute intoxication, remember I said when you do cocaine you kind of feel irritated, irritable, agitated, possibly lead to a form of psychosis, a substance-induced psychosis. What you would give is you would give an antipsychotic agent for that. So again, mainstay is going to be supportive. However, if you have some very serious agitation, you can give an antipsychotic. And if you have a long withdrawal depression state, you can give an antidepressant.